Welcome back to our channel, and our topic for today is about sex change or gender reassignment surgery. Overview: the background, distinctions, two ways to view gender, dysphoria, ethical issues, and further thinking. Background assumptions: sex has three meanings: genetic, XY, XX, XXY, and etc. Phenotypic, what you look like, physically, social, how you are raised, how you present. Gender as one, meaning the social or behavior aspects of sexual identity. There is no one-to-one relationship between sex and gender. Sexual dimorphism is part of the mental landscape in our culture. First question: when baby is born, treatment of intersex babies. As a species go, we are not too dimorphic. Variation within the sexes are greater than the variation between them. There is a lot we don't know about sexual and gender development. How genotype is translated into phenotype. What hormone surges in utero at puberty? Do what can go wrong? How people feel like, women or men, apart from social conditioning. Distinctions: heterosexual, homosexual, bisexual, transvestite, transsexual, and transgender. Heterosexual, homosexual, and bisexual describe sexual attraction grounded in biology but affected by culture. Medically speaking, these are not disorders. Attraction is fluid and changing. Most people think attraction is established before birth. Transvestite describes people who wear clothes of the other gender. Catholic teaching: sexual function has two purposes: fun, babies. Double effect: good or moral, neutral act. One effect intended, one foreseen. Bad effect is not a means to the good. Transsexual and transgender terms refer to the same thing: gender dysphoria, DSM-4. Transgendered person can be self-identify as gay or straight. Some transgendered person get married. Some engage in homosexual relationship with members of their new sex. Gender dysphoria, one view: objectively disordered, psychiatric in nature. You don't do surgery for psychiatric symptoms. Gender reassignment surgery mutilates and results in sterilization. Therefore, this is wrong. Gender dysphoria, the other view: biological in nature. Hormone surge in utero contributes to sexualization of fetus. Disruption can cause GD. Male and female brains differ in some respect. M minus greater than F. Brains look like female brains, and F is less than M. Brains look like male brains. Gender dysphoria, the other view: if gender dysphoria is biological, then surgical correction is appropriate. Other surgical corrections: strabismus or strabismus, cochlear implant, aortic repair, LASIK surgery, septoplasty. Mutilation and sterilization are side effects. Surgery is last step in transition. Transition includes psychological counseling, living as the other, hormone treatments to affect secondary sex, characteristics, hair growth, breast size, voice, plastic surgery to fashion new genital and urethral equipment. Alright, surgery is the last step in transition. Transition includes psychological counseling, leaving as the other hormone treatments to affect secondary sex characteristics like hair growth, breast size, the voice, plastic surgery to fashion new genital and urethral equipment, mastectomy for F minus greater than M, breast augmentation for M minus greater than F. Cause of action in ceton losot, that's the asterisk. Some transitions are finished without surgery. Expense, mutilation, irreversibility. Ethical issues. Should surgeons be allowed to perform gender reassignment surgery? How do we take care of our patients after surgery? How do we take care of transgendered persons in the hospital for other reasons? Allowing surgery for GRS or gender reassignment. Patient must be part of the program. Program must be rigorous. Surgeon must have experience, double-boarded in some cases. Treat these patients fairly. Ethical issues. Respect for transgender person means using the form of address and pronoun he or she chooses. How the person present is the person's socially identity and should be honored. Protecting privacy, especially with regard to roommate, if there is one. Private rooms are nice but not always possible. No one taking care of the patient should be surprised. Confidence must be held carefully. Country, and here is the country famous for sex change. Thailand. The Thailand's medical professionals are highly qualified. Both male to female and female to male surgeries can be performed in Thailand by some of the most experienced surgeons in the world. Many Thai doctors and surgeons practicing today have won awards for their endeavors. More than 500 doctors practicing in Thai hospitals are American board certified. Cost saving. The cost of medical treatments in Thailand is significantly lower compared to identical treatments in the developed world. In fact, treatments in Thailand are typically far less expensive than elsewhere in the world. No waiting list. Appointments for treatment can be arranged. There are enough qualified surgeons that there is little if any waiting or scheduling even the most complex and invasive procedures. Thailand's medical technology is state-of-the-art. All of the Thailand's leading hospitals feature state-of-the-art technology that helps them provide the highest degree of medical treatment and service. Thailand offers excellent service. And here are the prices for its treatment. Sex reassignment, $3,000 to $13,000. Sex reassignment, male to female, is the same price as female to male. Sex reassignment, female to male. Alright guys, that's it for today, and don't forget there is questions at the end of the video and don't forget to answer it. Alright guys, here is the question you should answer on a piece of white bond paper and send it to our Google email, your answer, and the hard copy must be kept on the brown envelope and will be collected 1 week from now. Alright, first question is, how do you know which bathroom a transgender person should use? Number 2, what if someone doesn't look masculine or feminine enough to use a particular restroom? Which restroom should be a transgender person use if the person hasn't had genital surgery? Don't unisex bathrooms leave women more vulnerable of being harassed or attacked by men than gender segregated bathrooms? Or do unisex bathrooms leave women more vulnerable of being harassed and attacked by men than gender segregated bathrooms do? Number 5, are individual or unisex restroom better for transgender people than segregated bathrooms? What should an employer do when a non-transgender employee complains about being uncomfortable sharing restroom with transgender employee? Number 7, are employers allowed to tell an employee to use restroom that does not match the person's gender identity or presentation? Last number, is it okay to propose that a company's restroom be more trans-friendly? Alright, that's all for today, folks. And don't forget to subscribe. Of course, make a lot of comment on every video that we uploaded. And that's your attendance. Thank you.